Hello everyone. Today our team is highlighting a public health issue that is making a quiet resurgence worldwide: syphilis. Syphilis, a centuries-old infection caused by Treponema pallidum, is re-emerging in various countries, communities, and age groups. Despite being completely curable with penicillin, the disease's rapid resurgence is causing alarming rates of infection, which have not been seen in decades. A BBC report cited in 2024 indicates that syphilis, a sexually transmitted infection, is increasing in all corners of the world, with more than 7 million cases in 2020, which means that cases in the U.S. nearly doubled in the last 4 years, and there was a 389% increase in Canada between 2011 and 2019. We must be concerned about all infections, yet the continued increases of congenital syphilis, where the mother passes on the infection to the baby during pregnancy, are of particular concern, as these infections can then lead to loss of pregnancy, stillbirth, death in infancy, or complications in infancy. These outcomes are preventable with early detection, testing, and care. Dr. Isaac Bogach of the University of Toronto argues that rising syphilis rates highlight a public health failure with inequitable access to testing and management services, social stigma, reduced funding, language barriers, and the COVID-19 pandemic impacting care beyond testing for vulnerable populations. This resurgence sends a strong message about the additional line of work nurses and other healthcare practitioners take on as part of their roles. It is more than effectively treating an infection, but advocating in more important spaces to reduce the stigma surrounding it. The Lancet and the Nurse Practitioner Journal have stated that nurses play a huge role in prevention by providing access to education, being advocates for their patients, and by providing non-judgmental, compassionate care. Creating a safe space and promoting the importance of sexual health literacy and equitable access to HIVs can bring about significant change in the reduction of transmission and stigma surrounding sexual health. In summary, the resurgence of syphilis serves as a reminder of the decline in awareness and the emergence of inequality. As nurses, we can restore this awareness by providing patients with health knowledge and ensuring safe, respectful, and equitable care.
The rise of syphilis has become a serious public health concern as outlined in the 2 peer-reviewed articles, Syphilis: A Growing Concern by Harmon and Robertson, and Syphilis by Hook. Medically, both articles explain the increased cases of syphilis over recent decades and the certain groups of individuals who have mainly contributed towards it. This includes men who have sex with men and individuals with a coexistent HIV infection. If left untreated, syphilis can cause severe health complications, including neurological, cardiovascular, and skin damage. In an economic lens, both articles explain the financial burden syphilis has on low-income communities. The treatment for syphilis is expensive, especially if it is not detected in the early stages. People in impoverished areas often lack access to secure and affordable healthcare, placing them at higher risk of infection in contrast to those living in high-income communities. Lastly, from a political perspective, both articles explain the ongoing stigma syphilis has in society and how it impacts people from receiving proper testing and treatment. Additionally, many public health systems fail to prioritize syphilis prevention and sexual health education. As a result, many remain unaware of the risk, symptoms, and available resources for the disease. Overall, both peer-reviewed articles explain the severity of syphilis and the impact it has to our medical, economic, and political systems within society.
Critical social theory is a philosophical approach looking at how social, political, and economic systems create inequities and power imbalances between people, especially when it comes to accessing essential services such as healthcare. In the news article, the author uses this approach to show how the increase in syphilis is not just an individual problem, but it's instead a reflection of larger social issues. They point out that factors like racism, poverty, unstable housing, and lack of proper health care to be the main contributions to the increase in the syphilis case. The article shows how these issues affect the marginalized groups the hardest, especially the Black and Hispanic women. The research assistant in this article commented that the higher number of the congenital syphilis case found within this group of people reveals the ongoing systemic racism and unequal treatment within our healthcare and public health system. The author supported this by giving examples from Australia, Brazil, and California, where women with low education, no insurance, and limited access prenatal care face the high risk and rate of having congenital syphilis.
Social justice is a philosophical approach that advocates equity for all people. The author further extends the discussion by using social justice to address the problems in the healthcare systems. The author highlights the importance of reducing stigma, providing equal access to healthcare, and treating syphilis as a normal illness. A public health expert mentioned that the rise of syphilis is very concerning, especially because it is a disease that can be treated. The expert encourages people to take responsibility by getting tested regularly and being open to STI prevention. The expert also calls for more community testing, better outreach, and normalizing STI screening as part of maintaining healthy sexual well-being.
The framework shifts the focus from blaming individual to looking at the increase in syphilis as a systemic problem. Critical social theory recognizes those social factors that affect health, such as education, poverty, and stigma. And social justice helps to advocate and act to correct those inequities and imbalances. And together they make meaningful change by promoting equitable access to health.
The discussion should include how governments and systems fail to meet the healthcare needs and support for vulnerable populations, rather than seeing people as data and victims of the oppressive systems we have in place.
Marginalized communities may make up a lot of the syphilis cases because they may have financial troubles accessing healthcare, they may have existing stigmas surrounding STDs, or even have limited knowledge about the transmission and prevention of STDs. Among those marginalized communities would include impoverished families, the Hispanic community, the LGBTQ community, sexual assault victims, immigrants, and people who live in remote areas. Despite only making up 3.8% of Australia's total population, Aboriginal communities have higher rates of syphilis, suggesting insufficient access to healthcare amongst these smaller communities. With this in mind, the study should include data from both marginalized and oppressor communities as a whole to really delve into the reasons for the resurgence of syphilis in a more broader context.
Amidst the rising cases of syphilis, as healthcare professionals, we must advocate for equal accessibility to healthcare services. It is vital to know how syphilis spreads, sexual transmission, or direct contact through open wounds. Hope notes that during latent stage, syphilis may appear asymptomatic, thus encouraging safe sexual practices such as condom use, limited drug or alcohol use, and regular testing minimizes the spread of infection, especially amongst individuals at higher risk, such as with multiple sexual partners. Awareness that syphilis is curable in its early stages destigmatizes the infection and other STI screening, treatment, and counseling. Healthcare providers can advocate for the use of antiretroviral medication for syphilis-negative individuals, which does not prevent HIV or act as an alternative for unprotected sex. With available STI screening, particularly for antenatal care, we can monitor congenital syphilis, preventing transmission during vaginal childbirth. Such strategies, implemented by nursing professionals, are necessary for pre- and post-exposures to syphilis, protecting vulnerable communities.